When you receive your medication, store it at room temperature until it is used. The box of Arvekap contains 7 vials with powder and 7 ampules of solvent. For the injection, you will need a 2.5 ml syringe for intramuscular injections and 1 separate subcutaneous injection needle. The injection should be performed on the exact date and time your coordinator instructs you to perform it. For your triggering injection, you will be needing 2 vials with powder and 1 ampule of solvent. Take the ampule of solvent and tap the top end gently to make all the liquid fall to the bottom. Hold the ampule with the blue tip pointing towards you. To avoid cutting yourself, cover it with a gauze and break it open. Insert the needle into the ampule of solvent and aspirate all fluid by pulling back the plunger. Then take the plastic cap off the vial of powder. Take the syringe containing the solvent and pierce the center of the rubber stopper with a needle. Then press the plunger down, slowly adding the solvent and not shaking roughly, but mixing the contents by swirling gently with your hand. After the powder is fully dissolved, pull back the plunger, filling the syringe with the total contents of the vial. Any residual fluid is removed by turning the vial upside down, moving the syringe further down, and pulling again the plunger backwards. Take the second vial of powder, remove its protective cap, take the syringe filled with the solution, and repeat the process. Now you will have inside the syringe the solution of 2 vials of powder and 1 ampule of solvent. Recap the mixing needle and remove it. Attach the small subcutaneous injection needle. Hold the syringe with the needle pointing upwards and tap it gently until all the air rises to the top. Press the plunger slowly until the air is removed and you see a small drop of liquid forming at the top of the needle. You are now ready for your injection. The small needle is designed to deposit the medication subcutaneously, and thus you will need to insert the whole needle into the skin. Subcutaneous injections are performed in the lower abdomen. Use 3 fingers placed under the belly button to find the location of your injection. Please note that it is important to alter injection site. When you choose your injection spot, take an alcohol swab and thoroughly clean the injection site. With one hand, pinch your skin and insert the needle at a 90-degree angle. Push the plunger slowly and steadily, without stopping, as far as it will go. Next, let go of your skin and pull the needle out gently. Press down on the area for a couple of seconds with the swab while massaging it lightly. Dispose the syringe along with the needles, the ampule, and the empty vial in a suitable container, or bring them to your nearest medical facility where they can be safely disposed. If you have any further questions, please feel free to contact our IVF unit.